Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with people who are making it happen. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is brought to you by Health Lyrics. Need a health IT executive coach? Let's talk. Visit healthlyrics.com to schedule your free consultation. Today, we're joined by Chad Brisendine, CIO of St. Luke's University Health Network, and one of my favorite young CIOs. Morning, Chad, and welcome to the show.
Good morning, Bill. Thanks again for having me.
I'm going to keep you in that class of younger CIOs, since every time I go to one of these Chime events now, it seems like people are in their late 50s, early 60s as CIOs, and you're not in that category yet, I don't think.
Nope, just at my 40th birthday.
Well, congratulations. Well, I'm excited for our conversation. So today you have a hard stop, so we're just gonna jump right into it. Our two main topics today are price transparency, something which I think St. Luke's has done a really good job on, and on consumer engagement. So let's just jump into price transparency, because I heard you give a talk at the HIMSS event, and it was pretty exciting as the direction you guys were going. So every health system's handling price transparency just a little different. Why don't you give us some background on what your team did and how they approached it?
Yeah, so a little bit of background. I think first I would say our CEO's vision has always been to have low cost, high quality, easy access. Access from a consumer access standpoint, as far as services availability, location, quality. Obviously, that means a lot of things, but we have very defined quality program and mechanisms, and then obviously cost. And one of the things we've always felt is that we do have a cost advantage in our market and beyond from what we consider cost. And I know that's a hairy subject whenever you talk about it in healthcare. But for me, it's all about the consumer's cost and the consumer's out of pocket, and that's the vantage and viewpoint that I really take and that we really take. So we were doing that work back in 2013, 2014. We were doing a lot of research around what transparency and what cost transparency or price transparency was, and we really weren't able to find a lot. People had some organizations, and where I came at before, also had their prices online, which was basically their fee schedule on there. It's kind of what happened with the government regulation. They said, put it on there, everybody put it on there, and nobody can understand it. So in about 2015, we decided to build out a prototype of what we call Price Checker. And basically we put online prices available, but what's unique about that price transparency is that it's a bundled price. It's meant to be for people that have high deductible plans and have a cash price. And what's included in that is a bundling of services, and it's a cash price, and you don't get a bill. And it also counts towards your insurance. So if you have a $5,000 out of pocket and the service costs you $4,000, then you still have $1,000 left to meet your deductible. So I'll pause there because there's a lot to it, but that's what it's meant for us, is about being able to provide certain consumers and segments of consumers a fully bundled price.
Yeah, and I'm going to go back to that, but it really is true that what we've seen is sort of a compliance approach to this as opposed to a consumer approach to it. And the compliance approach is, all right, let's go to the charge master, let's print these things out, let's put it into a spreadsheet, let's go ahead and put it out on the website. And then when you download those things, you take a look at them, you can't figure anything out. I mean, you've looked at a charge master, I've looked at a charge master, it's really hard to navigate. Your consumer approach is much more, it's mobile, you have a mobile platform that they're able to go in there. They're able to see their price before they're even able to get in there. And actually, in some cases, because it's bundled and whatnot, you will offer, if I understood what you were saying before pretty correctly, you're actually offering a discount for paying up front for some of those fees.
That's correct. So actually, we have two versions of it now. We've partnered with a co-development company and have included some additional price or billing transparency tools within that as well. But basically, you can do an estimation now. So if you have, for example, you can go in there and look at your blue price, and you can look at what we call the price checker or price lock price, which basically gives you the discounted price that we have. So you can go with either or. based on your insurance type. So that's available now as well.
And that's right. I mean, it makes sense to really target the high deductible plans, because people with low deductible plans aren't really consumers as much of healthcare. But those people that are price sensitive, these kinds of tools make a lot of sense. And that's, are you thinking of making it more broad than that, or are you going to continue to focus in on that market?
So our market has been primarily focused on, high deductible plans, I'd say, because they're the most ones that call to action. We have all the other transparency tools, like I said, the estimate, out-of-pocket estimator, all that stuff coupled into all this, because it's for the folks that have commercial insurance. So the way we look at it is, if you have a secondary commercial insurance, we have a set of products and capabilities to make that transparent for you. And then for the high deductible plans, we have that as well. And where I think we're unique and different is in the high deductible plan. I think a lot of people have put price estimation for commercial insurance folks out there on their web or mobile or whatever they've done. But where we're unique is this bundled high deductible. So for example, it includes your anesthesia costs, your OR costs for your surgical procedure, and your pre and post, 90-day, those physician visits that you have. So what we've done uniquely is partnered with our physicians in the community and said, here's the rate we're going to take on all these things for it. St. Luke's will take the full amount from the consumer, and then through our kind of B2B transactions, we'll pay the physicians, do the collections and all that stuff, but the patient at the end never gets a bill. So we've kind of taken that, kind of all the transactional issues that people have with in a high deductible plan, of being able to, because the problem is if you come to us and say, hey, I want to get a knee surgery. You say, what's the price of that? Well, I can tell you how much the OR time costs. Well, no, that's not what we want. We want to be able to fly from, LA to New York all in one trip, and I don't want to have to go this person for my luggage, this person for my airplane ticket, this person for the food that's delivered on me. I want it all in a bundled thing. So we've created a B2B relationship with our physicians, and the B2C relationship is the consumer to St. Luke's.
Yeah. So talk about the project. So there obviously is there's a technology component to it. Talk a little bit about that, and talk about the business side of it, because there obviously was a lot to bring that network together, get the pricing. There's an awful lot of work to do there as well.
This work was obviously the business side of that, which I give our COO and our one of our project directors a lot of credit for doing a lot of the legwork on how we're going to actually make this into like a business model. And I think the unique thing that they were able to do is, well, they did a lot of consumer research. So just calling out there and asking people, what do people really want, and what do they mean, and what would they check on, and how would they do things? So some voice of the customer work, right? Not as sexy as maybe marketing would do, but low skill that actually our project director had their family members and talked to all their family members, and then they had their family members, and then we checked other hospitals and called and everything. So pretty good, I think, idea of what consumers really wanted and needed out of this was the first approach. Finding out what they needed was a bundled price. So being able to develop that bundle price, it was literally working with certain procedures. So we started with the simpler procedures to start out with. Now I think we have a couple hundred out there, but I think we started out with like 10 CPT codes that were out there. And then and then certain physicians that we only worked with to start out, and then we began modeling it. We also created a contact center specifically for this. So being able to set up a contact center, being able to check to see how many customers were getting us. So all the kind of components of what it would take to run a true, customer contact center with being able to handle contract management and being able to handle, the consumers asking questions and how to handle all that. So I'd say that was a lot of heavy lifting of trying to get physicians on board with taking a certain rate for these patients. Because this isn't like 40% of your commercial business is going away with these rates. It's at least in our market today, it's a percentage of our business that we're willing to have a negotiated discount for. And it was getting the physicians, I think, on board with that conceptually. So I think that's really where a lot of the heavy lifting were. So that's the business ops side.
Yeah. So what about the technology side? So you like to partner. Did you do something off the shelf and then partner with that company in terms of customizing it for you guys, or did you build something out?
Originally, the real quick prototype was just literally the web page. And as it got traction and we got more and more views, we determined, we could either build this thing and fully scale out front and back end, or we could really partner with somebody. And we were already doing a lot of work on transparency with the estimation, bill pay, et cetera, with the vendor partner, and we decided to co-develop with them. So they took the product, built it within their platform, and now I think we're on version 3 of that release that's out there. So they have that product in the market, generally available as of probably about 6 or 9 months ago.
That's awesome. So transitioning a little bit, because we're going to transition into consumer engagement. So how did you make the community aware of the program? I mean, was it billboards and ads and the traditional things? I mean, how did you get adoption?
I think there's a number of different ways. One, it was there's a business coalition that meets here, because a lot of this is us informing the business leaders, because a lot of this is like, right, certain businesses have decided to go with the high deductible for their employees. And so it was a lot of the local business bureaus and stuff like that our team did education and communication on. It was literally patient stories. So we've gotten the news several times because people heard about these stories. So a lot of word of mouth, obviously digital. We didn't do any billboards or anything like that, but a lot of digital marketing, Facebook, LinkedIn, et cetera, with patient stories. We've had a lot of really great patient stories of people coming from other more, our market, and you've been here, your family's from here, so our market's kind of nestled north of Philly about an hour, and we're to the west of New York about an hour and a half. We actually got patients from both of those demographics to come to us because no one could really find this thing. So a lot of those stories were, we had travelers that literally came to us just because they couldn't get a price anywhere, needed to know what the total price was going to be for a procedure, and end up paying cash for our business. So a lot of that, and digital marketing around that.
Yeah. So the last time you were on the show, which was a pretty listened to podcast, you talked about the development of a consumer engagement tool built on top of the Epic APIs with a really small development team and an external partner. I think it was closer to a year ago we had that conversation. Can you give us an update on that? I mean, you had just rolled out a handful of applications on top of it. Here we are a year later. Where are you at?
I looked the other day, we're at 143,000 unique logins for the month, and on average 7 times that someone's revisiting. We're continuing.
So what are you offering that people keep are logging in and keep coming back?
I mean, I think a lot of it is core what's inside the Epic system. A lot of the high transactions are what's inside the medical record that people touch most of the time, right? I mean, you're a new patient a few times, but once you're a new patient and you're in the system, you're constantly going to all your different tests. So what we're trying to do right now is look to optimize those different journeys within that piece. But right now we're continuing to try to expand our scheduling capability that we have in there. We are in the next release, we're continuing to bridge. We had a white label video visit platform in there, and we're continuing to bring capabilities from that white label into our mobile and web experience. So that's continuing to enhance that. We just hit our 4,000th consumer video visit. We've had more than that in total, but 4,000 unique video visits. We just did that this week inside of there. So I would say that the highest transaction is going to be results and stuff like that, just because you have so many of them that are pumping out that people are looking at. But what we're trying to optimize to is registration and scheduling, and trying to ease all the pain of the high transaction areas. And that's our next set of releases, is focusing on reg and schedule, and how do we continue to optimize that. Our last feature that we rolled out that we feel like is really cool is the not feeling well component. I don't know if we talked about that or had that deployed at that point, but that is basically low acuity triage is the best way of looking at that. So when I'm on my mobile app or web or whatever, I can look and see, and it does it by time of day. It does it by what services are available at what time, and it also does it by what's available now. So on my app, I can see three care settings, which we're trying to position them to. One would be, what appointments as a new patient or an existing patient are available for my primary care or my favorite physician, because I can click my favorite physician on my app within the next 24, 48 hours, which urgent cares, because we have a lot of convenient urgent cares really close to you. And it's all done by location proximity. What urgent cares are available for you, and you can clock into those ahead of time, or skip the wait is what we call it. and then also the video visit. So we tee up different things for you based on the time of day, based on the location, et cetera. So it's kind of hypersensitive to, I'm not feeling well and how do I get care now? But it gives me multiple options for that care now. So we're going to continue to advance that capability. It's still new. We're probably 2 months into the release of that. So we have more optimization, but the whole thought is get you in, give you multiple options for that based on your preference as a consumer.
Yeah. So you're baking on top of the Epic API. Your largest competitor in your market is on Epic as well. I mean, what advantage does this give you? It sounds like you're layering an awful lot of technologies on top of this to really take the friction out of the environment and improve the consumer experience. What benefits do you think you're getting at this point?
Well, I think that there's there's maybe three worlds to view this in, if you want to. There's the view of, I'm going to build all my consumer stuff all on my own. You know what I mean? And everything's going to be custom built and it's going to be 100% that way. And if, you're a CIO, you do that to have, high competitive advantage, high differentiation advantage, right? So that you can build anything you want for your consumer. Then there's the middle of the ground. That's where I call us, where you leverage all the capabilities that you can from a third party without building them. And then you build what you need to give you competitive differentiation and advantage. That's the model I think we've landed on. And then you have the model of your Epic only. So, there's choice, I guess, in the matter of what architectures people want to pick. My view of the world is we get to leverage all the best capabilities of Epic. For where Epic, and I love Epic, I mean, they're a tremendous development company. They pump out a lot of amazing stuff, but they don't have everything, right? And they're never going to have everything. And so how do we fill the gaps in? Because a lot of the capabilities I just mentioned to you are not things that we have in Epic, but I'm leveraging a lot of what we have behind Epic to push that to you as a consumer. So where I can, a button's going to be from Epic from the back end, but a button may be from another third-party vendor that we leverage in the ecosystem. So I know that's a lot of words.
I mean, I love how you frame that up, to be honest with you. I mean, it's because I have seen the fully custom shops. I've seen the people building on top of APIs. And then I've seen the people just roll out, hey, here's my chart, and away we go. And and you run into this. I mean, you'll develop something, and then Epic will put it on their roadmap, and you'll have it in 2 years. And that's part of the challenge of building on top of it is, sometimes you're gonna develop some stuff today to go to the market that's going to be replaced in 2 years. But that's just the nature of the business.
That is the nature of the business. I think we do it on the internal world a lot because we'll buy a third party. Epic's not ready. We'll buy a third party app internally. Epic's not ready. They don't have the capability. There's many spots where they still don't have the capability. We have a third party or we buy a third party. As soon as we can move it into Epic because it makes sense and it meets all the requirements, we move it into Epic. And there's no difference on that on the consumer. The only difference on our consumer is the front UX UI that you'll always see will always be ours.
Yeah. It's interesting. So what's the biggest surprise? So you're over a year into it, year and a half, 2 years into developing on top. What's the negative and positive that you've experienced?
I don't think there's a lot of lessons learned on all this. I think the understanding the true journeys of these consumers from end to end, like you think you know what end to end is until you start going down and then you look at end to end, it's different. And I would just say, it's the journey mapping, it's the customer, it's the hard work, it's all the different components, figuring out what should we really do next, the prioritization of that. And then the technical architecture, I think it's very complex. I think there's certain vendors, as I mentioned, my EMR vendor does a great job at it. To be honest, they're one of the best ones to provide an SDK and an API and all that, even though everybody knocks them for that. They have been the best out of all of our partners from that perspective, even though you would think you would get something better out of Silicon Valley related to an SDK or an API. But everyone who wants to do, the easy way out on this, they want to go HTML5 and they want to push out a mobile, a web to mobile rendered, which is, they call it, interactive. I call it slow. So I think, there's all different ways to deliver these things. And at the end, I think it's just all about, what do you want for your consumers? And my perspective is we want the best experience possible. I wouldn't say I have that today. I would say our our long-term goal is to have the best consumer experience possible. And I don't consider it a small project. I consider it a journey, something we're building over.
Yeah. Chad, I want to thank you for the time you gave me. I know you came from a meeting. I know you're going to a meeting, so I want to honor your time here. And I just appreciate this quick visit. Hopefully we can touch base a little later in the year when the schedule slows down a little bit.
Thanks a lot, Bill.
Sure. This show is a production of This Week in Health IT. For more great content, check out the website at thisweekinhealthit.com or the YouTube channel at thisweekinhealthit.com/video. Thanks for listening. That's all for now.